Hello, everyone. I'm Dr. Shayla Toombs-Withers, family physician here at Essence of Health Wellness Clinic. Thank you for joining me today. So this week, May 10th through the 16th, has been designated as National Women's Health Week. So National Women's Health Week is a week-long health observance led by the United States Department of Health and Human Services Office on Women's Health. According to this department, it serves as a reminder for women and girls to make their health a priority and take care of themselves. Just last weekend, we celebrated Mother's Day. And one of the things I shared last week was how we as mothers and as women, we often put ourselves last in order to take care of the needs of everyone else in our family. So this week is our week to serve as a reminder to us women, to take care of ourselves. So I want to share with you a few recommendations for women to help prevent certain diseases in an effort to maintain good health as we age. So first, let's talk about Pap smears. So cervical cancer was once one of the most common causes of cancer death in American women. However, with increased Pap smear screening in our country, the cervical cancer death rate has decreased significantly. Pap smear screening is recommended at age 21 and up through age 65. Pap screening with cytology, meaning just the lab test alone, is recommended about every 3 years for women under the age of 30, so the 21 to 29 age group. Over 30, Pap smear screening, the test, along with human papillomavirus or HPV co-testing, is recommended for this age group over 30. And if those tests are both normal and the HPV portion of it is negative, then one may not have to be screened again for 5 years versus the 3-year with the Pap screening alone. HPV, or human papillomavirus, is the virus that increases risk of cervical cancer. So if HPV does screen positive, then you may need to be screened with Pap smear more regularly. So the screening is a general guideline, but be sure to discuss further with your doctor for your personal situation. Now the next recommendation is mammograms. So according to the American Cancer Society, breast cancer is the most common cancer in American women, with the exception of skin cancers. The average risk of a woman in the United States developing breast cancer sometime in her life is about 13%, and that equates to about a 1 in 8 chance of developing breast cancer. But the positive side of that is there's a 7 in 8 chance that she may not develop breast cancer. However, the screening is important. Mammogram screening is used to detect breast abnormalities and cancerous nodules and masses in women. The recommended age to actually screen with mammograms has had some controversy over the past couple of years, and so that screening age is variable based upon your unique risk factors, which should be discussed with your doctor. However, for most women, screening should begin between the ages of 40 to 50, with repeat screening about every 1 to 2 years. Once again, depending on your personal risk factors, your family history, as well as depending on your previous screening results. The next thing that's important for women is having a healthy heart. Heart disease is still the number one cause of death for American women. Some women don't usually have those, what we think of as classic symptoms of heart disease or heart attacks, with just, the chest pain and the shortness of breath or kind of slumping over sensation that gets dramatized a lot on television. Some women don't typically have those symptoms, and it can go silent or undiagnosed until those symptoms become more severe. And so this is why prevention of heart disease is really very important. So some things for all women through as we age to remember is one, having a healthy diet, a plant-based diet with a predominance of fruits, vegetables, whole unprocessed grains has been shown to prevent one's risk of cardiovascular disease. Routine exercise, getting 30 to 45 minutes of exercise on most days of the week, about 5 days a week, has also been shown to reduce one's risk of heart disease. Not smoking, and if you are a smoker, stopping smoking can further decrease your risk of cardiovascular disease. Getting adequate sleep reduces stress, which also in turn reduces that risk for heart disease. And limiting your alcohol intake. For women, it's recommended no more than one alcoholic drink per night or 7 in a week. So making sure that you keep your alcohol intake under control to also reduce your risk for cardiovascular disease and to keep your heart healthy. Now, so let's celebrate those special women in our life. Let's help keep those special lady in your life healthy and help her to stay healthy as she ages through the years. Encourage her to have a routine physical and routine lab work with her doctor. Remember, the things that I mentioned are just some of the screening recommendations. There are other recommendations depending on one's personal risk factors, their personal medical history, as well as their family history. All of these things are important to discuss with your doctor and to go through to determine what screenings you should be having to help keep you as an individual healthy. So be sure to discuss those things with your doctor. And remember, the essence of health is in you. We are still in the midst of the coronavirus pandemic, and coronavirus, it was just released here recently that coronavirus is one of the leading causes of death in Americans in the month of April here in 2020. So we still should be mindful of our risk for coronavirus and our potential for not only catching coronavirus, but potential for complications from coronavirus. Just to take a closer look at our current numbers in our country, for the United States, we are now up to 1,384,930 positive cases. So that is quite a bit. And we have exceeded 80,000 deaths in our country from coronavirus. When we look from state to state, New York still tends to be greatly affected with 338,617 positive cases and over 27,000 deaths, followed by New Jersey with over 100,000 positive cases and close to 10,000 deaths from coronavirus. So our country still seems to be greatly affected from this virus. Now, looking at things here in the state of Tennessee, which is where Essence of Health Wellness Clinic is located, we are up to now 16,699 cases. This is information from the Tennessee Health Department. And this is actually an increase of 329 cases when they look at it compared to yesterday. And we are up to 287 deaths with an increase of 14 deaths over the past day. Our counties that are most greatly affected continue to be Davidson County, where Nashville is located, with over 3,000 positive cases, followed by Shelby County with over 3,500 positive cases, and then Truesdale County. Here in Hamilton County, where this clinic is located, we have had 319 positive cases, and we've stayed consistent at 13 deaths. Thankfully, there have not been further deaths from this virus over the past couple of weeks. However, as you may have noticed, the trend that the number of positive cases continues to go up. So it's still important to remember that we continue doing those things to keep ourselves and our loved ones safe, making sure that if we are going to be in close spaces with one another, that we wear a mask, or that we even, try to stay home unless we have to be out for some essential need. Make sure that we're washing our hands once we've been out, and that we aren't touching our face or our nose when we are out without washing our hands or using a alcohol-based hand sanitizer to keep our hands germ-free and to prevent us from spreading disease from one to another. And so that is where we are with coronavirus. But I just really wanted to make sure that women were celebrated, that women remember that you are important. You're an important member of your family. You're an important member of society. And as we celebrate National Women's Health Week, remember to keep yourself healthy and to do those things and see your doctor at least once a year, maybe more routinely if you have some ongoing health issues, so that you continue to stay healthy. Essence of Health Wellness Clinic does continue to accept new patients at this time. You can learn more at www.essenceofhealthwellnessclinic.com. You can also follow me on Instagram at Essence of Health Wellness Clinic, or check out my YouTube page at Essence of Health Wellness Clinic. Thank you. Have a good Friday.